Hello, my name is Richard Weller, and with my colleague Chris Dibben here in Edinburgh, I've got a long-standing interest in the effects of sunlight on cardiovascular disease. Early in the COVID pandemic, it became apparent that comorbid heart disease was an adverse risk factor, so Chris and I wondered whether sunlight might affect COVID outcomes. At that point, it was too early to look at seasonal data, but we realised we could test our hypothesis with data coming in from America because of the large size and thus varied UV environments in that continent.
Using satellite data, we could measure amounts of UV falling across the United States, but exclude from analysis those areas where enough UVB was falling to form vitamin D. So we only analysed counties during their vitamin D winter. Before correlating UV with deaths from COVID, we carried out two important corrections. First of all, we corrected for your risks of encountering somebody with COVID and catching it. So that was things like population density and proportion with infection. Secondly, we corrected for factors associated with adverse outcomes from COVID, such as age and ethnicity. So having carried out these two corrections for confounders, we could actually look at the relationship between UV and COVID. And what we find is that the more non-vitamin D forming UV you're exposed to, the lower your risk of dying from COVID. We then repeated this analysis in England and in Italy, independent data sets, so independent studies. And we find the same thing. The more UV you're exposed to, the lower your risks of dying from COVID.
So what does this mean? Well, number one, mechanism. If we can work out how sunlight reduces COVID deaths, that could suggest new treatments. Number two, public health. Sunlight's available for free everywhere, even here in Scotland. Should we be actively encouraging people to get outside in the sunshine? I hope you enjoy the paper. We'd love your feedback. Thank you.